Biometix Technology Company Limited has developed the world's first 9G test cancer lung that can distinguish healthy people from lung cancer patients in stage 0 to 1 and stage 1 to 3. Lung cancer has a very low 5-year survival rate of 17.2%. The reason is that there is no appropriate diagnostic technique to diagnose from stage 1 lung cancer. Therefore, many countries have adopted LDCT as a lung cancer screening test, but LDCT alone is difficult to improve lung cancer survival. The purpose of the 9G test cancer lung is to allow doctors to request a thorough examination for patients with suspected stage 1 cancer. The simultaneous service of 9G test cancer lung and LDCT can increase the efficiency of lung cancer diagnosis and reduce the incidence of unnecessary biopsy. 9G test cancer lung consists of a diagnostic kit, various reagents, and analysis system BMT9G1000, and accurate results can be checked within an hour using a small amount of blood. Let's find out how to use the 9G test cancer lung. First, the user wears a lab coat and gloves. And set up the reagents, kits. And analysis system of 9G test cancer lung. Next, prepare a blood sample. If the sample is frozen, leave it at room temperature for 30 minutes to thaw it. Set the sonicator's water temperature to 25 degrees Celsius while the sample is being thawed. Take out 4 types of antibody mix stored at -20 degrees Celsius from the freezer. Perform ultrasonic vibration for 10 minutes using the sonicator. The frozen solution will melt and homogenize during this process. Vortex makes the homogenized 4 types of antibody mix 3 times per second each. Set the 4 types of antibody mix with the BMT9G1000 turned off. Insert membrane 24 strip into BMT 9G1000. Set R buffer, W buffer to 9G1000. Check the location of each of the 4 types of CS1, CS2, LS1, and LS2 antibody mix and the location of the buffer. Set the tip. Prepare the reaction tube in the well plate rack. Prepare pipette and pipette tip. Add 20 microliters of each prepared sample into 4 reaction tubes respectively. Total 80 microliters. At this time, be careful not to mix with the lower layer of the sample and use only the supernatant except for 20% of the sample. Place the prepared sample tube in the sample rack of BMT 9G1000. Open the antibody mix tube cap and buffer tube cap. And turn on the equipment. Now, run the BMT chip program. Click Reset Tip and Initialization. Select the CS1 program. Click Add. After setting the sample, select the program in the order of CS1, CS2, LS1, LS2. Set volume to 20 microliter. Then click Order Self and Lock. Click Patient and enter patient information. Visually check the location and order of the membranes and click Next. Check membrane counting. When the counting is finished, click Run. Click Start to start the test. The incubation step in which the antibody mix reacts with the blood sample is performed for 11 minutes. After mixing the R buffer with the reactant, the mixture is injected into the membrane to carry out the antibody genetic hybridization step. The step of cleaning will be performed by injecting the W buffer into the membrane. When the test is finished, check the result through the program. If you right-click the result value and click Result, you can check the detailed graph. If there is not enough tip, replace the tip and proceed. And if there is not enough solution, you must add more solution.